Hi. I'm very happy to be here today. I want to talk about our work on NLP in healthcare. And when I say our, I want to stress that this is multidisciplinary, multi-collaborators, multi-PhD students who, of course, I don't have the time to acknowledge. So the first project I want to discuss is creating clear, concise, lay language personalization hospitalization account for patients who have access to their healthcare record but find things like a discharge summary that are incomprehensible. Dr. Boyd, in the first part of these talks, has already touched on this. The PHA should integrate doctors and nurses' documentation, providing summarization, should be simplified in the sense of providing appropriate language, and then it should be informed by the patient's sources of strength and concern. So here I'm showing the first version of our prototype. I draw your attention to the first paragraph, in which first we are telling Natalie that we are sorry to know that you were admitted for coronary artery disease, acknowledging her experience in the hospital. We are explaining what coronary artery disease is. The last word, atherosclerosis, that is highlighted, is one of those included in the glossary shown on the right, in which they can go and find simple definitions. Then I will talk about conversational assistant, 2 projects in this area. The first, HF Chat, supports culturally competent lifestyle assistant for heart failure patients. They imagine a patient at night with an Alexa-like tool who asks, may I start exercising? The challenge is that we want to be culturally responsive, especially given the populations at UI Health, and the challenge is how to model cultural competence in a computational fashion. The methods that we have used and are using are uncovering self-care concerns of African-American patients with heart failure. We have shown that large language models are not sensitive to cultural differences, and we are exploring neurosymbolic approaches to conversational assistant, meaning that while we are using the deep learning approaches of today, we are also using rules that can be invoked at appropriate juncture to control them. Another one is the virtual health coach that interacts via text messages to help patients increase physical activities by setting specific, measurable goals. So, for example, if the patient says, I will walk on my lunch break for 20 minutes, this is not specific enough. The health coach might say, which days will you do that? So we are trying to model this sort of conversation. The challenge from, again, the machine learning approaches of today is the small data we have collected. We are still using machine learning and NLP, and we are actually providing support for the health coaches, suggesting messages that then they can choose to provide the patients. Thank you very much.